let's talk about the Safe Summer Cookout. I'm going to start with you on this one. Brooke, what is this program?
So the Safe Summer Cookout event is because National Fentanyl Awareness Day is March 7th all throughout the United States.
This is National Fentanyl
Awareness
Week.
Awareness Day.
A day.
May 7th.
Oh, tomorrow is the day?
Yes, sir.
Okay.
And so we got together with Peer Recovery Center. They had approached us about doing an event, and we brainstormed. We sat down, and we came up with Safe Summer Cookout event because fentanyl and overdose and substance use is something that affects everyone.
Right.
And substance use is usually something that begins in adolescence and young adulthood, unfortunately. So we were thinking about what's going on in the community. Well, everyone's about to get out for the summer. School's about to get out. So let's have an event where everybody can come together and we can educate the community on these substances and how dangerous they can be to make sure everyone has a safe summer.
All right. We're looking at a safe summer, but the other aspect of this is there are a lot of assumptions out there, are there not?
I guess so.
I mean,
with
really,
everything.
well, we're going to talk about this and how the insidious nature of ostensibly fentanyl, but there are other drugs as well.
Yep.
John Sortikes, again, is with us as well with Peer Recovery, and it's part of a program with county and variety of other organizations, one of them being Hope Mission and Hope Recovery. John, your endeavors here with the program tomorrow, Safe Summer Cookout event. By the way, I do need to make mention of the time. It's 4 to 7 p.m. tomorrow, yes. Tuesday, and it is free to the public?
It is completely free. Hamburger, hot dog cookout, a raffle. Don't have to buy a ticket. You get a raffle ticket at the door just for coming. So.
Okay. And this is an opportunity also, I think, to meet some interesting people.
Yep.
All right. John, what do you see as the value of this effort? And so far as in your capacity, with you work with a lot of people that have gone through addictive experiences, right?
Yes, sir. I think the most important thing is providing a free resource, changing the stigma, and providing an environment that's welcoming to anyone that may want help or may know someone that wants help.
You know, you bring up that term stigma. It's a good question, a good jumping off point. I'm going to you on this one, Brooke. First, let's talk about your background. You were East Carolina University
yes, sir.
Graduate. Your
Yes,
area of interest is public health. Am I correct?
Yes, sir. I just graduated with my master's in public health this December.
Okay. That term that John just shared with us, the term stigma. Mm-hmm. You've been working with the health department on this topic. You actually pretty much created this program,
mm-hmm.
did you not? We're going to talk about PORT here in a moment as another acronym. But
mm-hmm.
You've been through the schools working with students over the past 2 years. Am I right?
About the last year. Yep.
Okay.
Yep. So I have two schools left to do this semester. We've expanded it to 12th graders this year. So we're educating all the 9th graders and the 12th graders in the county schools.
I'm intrigued you went 9th and 12th. Okay. The term stigma, how important is that? Do these youngsters, and we're going to get to this in a broader sense here in a moment with John Sortikes, but focusing on the high schoolers, mm-hmm. do they is there a sense of stigma, or are they just taking it in stride?
I believe there is kind of a sense of stigma. I mean, among high school students, not as bad as I think I would expect, but there is a little bit out there because, I mean, they think they know everything off of social media. And so, and I mean, not to their fault. I mean, that's just how things are these days. And so they think they see something on social media or hear something, maybe from an older sibling or somebody else that they're around, and they just think that's how it is. When I go to the schools and talk to the students, the last day I ask them, raise your hand if you learned something today that you did not know on Monday when we started this class, and 100% of the time, every student raises their hand.
Really?
So they're definitely learning a lot. in these sessions, and I think some of that is breaking stigma or things that they thought that they knew. The first day we talk about misconceptions related to substance use, and we spend about 30 minutes just on that before we even go into the 4-day class.
I want to get to those misconceptions here in a moment. Back to that topic of stigma, John, and of course this goes to I'm going to say, not just to the high schoolers, but you've got to incorporate the adults in the room. That would be first and foremost the parents, extended family members, and just friends and family. My question to you, John, do you find that there would be a hesitancy on the part of particularly parents to want to acknowledge the fact that they may have a family member that's suffering from addictive nature, particularly now, of course, we're talking about fentanyl, because of the destructive and dangerous nature of it. It is a poison. It is not a drug. It's a flat out, it's a weapon of mass destruction, in fact. But John, do you sense that maybe there's a certain stigma among the adults to want to be careful about acknowledging there's an addiction situation?
I think there can be, Lockwood. I had a cousin that passed from a fentanyl overdose. She, she had the opportunity where she was at to seek help. She had family members that, were there for her, but in the end, it didn't work out. But I think there's a fear and a misunderstanding, with the addiction.
Well, I can acknowledge, though, the addictive person, the addictive personality, me being addicted to a drug and not necessarily associated with a stigma, but I've got that licked. I've got control of my life, which of course is the great lie. I do not. But I'm thinking about the family members, those that can, if you will, intervene, that can step in. Is there at times, John, just a failure on those people, on the part of those individuals that can intervene, that can provide intervention? Is there sometimes just a hesitancy because they don't want to hurt my feelings, or they don't want to acknowledge that yes, maybe they love me. That's hard to believe, but anyhow, that a loved one has an addiction. Is that an issue, though, that we've got to break down that stigma?
I think there can be. I mean, every situation's different.
Right.
At the end of the day, it's when that individual's ready, then the resources and the help's there.
Right. I think that's important. And that's the purpose of this program tomorrow. Am I correct on that, Brooke?
One of the purposes, to bring communities together, because this isn't an issue that just affects one group of people, one age group. This affects everybody. This affects everyone in our county. This affects everyone in the state. And
we're going to go to a break, and then I want to come back to the topic you said a few moments ago, and that's misconception. And I'm mentioning all of this because the purpose of today's conversation with Brooke Barnhill and with John Sortikes is to remind folks that there's an event taking place tomorrow afternoon, starting at 4 to 7 p.m. at Carteret Health Department, which is located on Bridget Street. You can't miss it. It's in the big curve, to use a better description, but and it's open to the public. But the other aspect of this, and then we'll go to the break. So many youngsters are attempting to, or are enticed to use an upper or a downer or something of this nature, just to experiment, only to discover that it's been laced with fentanyl.
Yep.
And the fact is, Brooke, that's a killer.
Yep. I've heard it described as, it used to be taking the path down the wrong road or the experimenting, but now it's like going out into a minefield, because someone could try something one time
and dead, and
that's it.
They're dead. Yeah. Too many instances. I've read too many stories about youngsters who attempted. They said, I wonder what it feels like to, take a downer or something of this or an upper, but only to discover they didn't survive the night.
Or they don't fully understand what they're actually doing when someone offers them a pill and what that means.
So the point of the matter is there's a lot of misconception. We're going to get to that in a moment. Stand by. We're talking with Brooke Barnhill, Carteret Health Department, along with John Sortikes of Peer Recovery. And we're talking about an event taking place tomorrow, Tuesday afternoon. That's May 7th at Carteret Health Department in Morehead City. It's open to the public to make an effort to attend. Well, by the way, doesn't matter what age your children are, right?
We'll have bounce houses, we'll have resource tables, we will have food. Anyone is welcome to attend. We encourage it.
And by the way, your attendance does not stigmatize you. As a matter of fact, I think that's important. I like that description a few moments ago, John. John mentioned a few moments ago the topic of stigma. Just your participation is not stigmatizing. As a matter of fact, it's educational. To your point a few moments ago, Brooke, you said in your conversations with the students, you asked them at the end of the first day or at the end of the first week when you're talking to them, and you're in the schools talking to 9th graders and 12th graders about the circumstances associated with drugs. You ask, did you all learn something you didn't know? And you said 100% of the time, 100% of the class raises its hand.
Yep.
You said misconceptions. Let's talk about what are those misconceptions?
So it depends on if we're talking about 9th graders or 12th graders, which misconceptions that we're talking about. But one of the most common ones is that they're safe drugs. A lot of these students.
There are safe drugs.
Yes, a lot of these students think that these vape stores where they can go buy stuff legally, that means it's safe. And so we talk about how that's not true.
When you say you buy it legally.
Yep.
First off, we're talking pharmaceutical drugs, right? Such as Oxycontin and I don't know.
Yeah, we talk about pharmaceutical drugs. We talk about vapes. We talk about alcohol. We talk about the gummies that you can buy at the vape stores. We talk about pretty much all of it.
Wow. The safe drugs.
Yeah, and so they think, I can buy this at a store. It's legal. It has only this much THC in it, or it's CBD. It's safe. It's okay because it's legal.
Okay, but the other aspect of this, and John, I know you're listening into that conversation, John Sortikes, but it's more than the drug. It's the impact that the drug can have on your life going forward, that this term of addictive nature. John, is that not a concern?
Absolutely. If there's undealt trauma, if they're using it as a coping mechanism, regardless, they're just using it to have fun recreationally, the ripples effects are, they're wide.
So it's not really just a matter of the drug. It's the influence this drug can have on their lives going forward.
Yep.
Alcohol. You mentioned marijuana. Of course, now we're looking at the potential of, we'll not get into that because I'm adamantly opposed to legalized marijuana, adamantly opposed to it. And I'm very hesitant about the whole issue of medicinal marijuana. I don't want to belabor that. I want to talk about the program PORT. What is PORT?
So our post-overdose response team.
One more time.
Post-overdose response team.
Post-overdose response team.
Yes, sir.
We're talking Narcan for most important, pretty much, right?
So we do distribute Narcan, but that's not all we do. The PORT team does a lot of really good work in the community.
Doing what?
They're a team of peer support specialists. And
like John Sortikes?
Yes. And for those who don't know, a peer support specialist is an individual that is in recovery and has been certified through the state of North Carolina, UNC Chapel Hill, to be able to use their recovery experience after taking a class to help others who are dealing with either substance use or mental health.
John, will you be there at the program tomorrow?
I will not be.
Oh, you will not be. Well, why? All right, I keep talking.
I'll be there.
You'll be there. All right, that's important. Ladies and gentlemen, we're wrapping things up. But I want to go back to the comment I made earlier about the stigma. Your attendance at this program with you, your family, your children, whatever, is not stigmatizing. It's educational, right?
Yep.
And what this is purpose of this is to educate, right?
Yep. The purpose of this is to educate the community on having a safe summer and the dangers of these substances.
And removing the misinformation.
Yes.
I think that's an important issue.
Yep.
All right. Tomorrow, 4 to 7 at the Carteret Health Department on Bridges Street in Morehead City. The public is invited. That's food, games, and above all, information.
Yes.
Please be in attendance. To John Sortikes and to Brooke Barnhill, thank you very much, both of you, for being with us today.
Thank you.